My name is Sarah Peacock, and today we're going to talk about epilepsy. So what is epilepsy? It is a central nervous system or neurological disorder that involves irregular brain activity that leads to seizures. The severity of the seizures varies from person to person, and there are two different types of seizures. First, we have focal or partial seizures, and that's abnormal activity in one part of the brain. And there are two different types of focal seizures. You have without loss of consciousness and with impaired awareness. This type of seizure may be confused with other neurological disorders. Next, we have generalized seizures that involve all areas of the brain, and there are 6 types of generalized seizures, and they include absence, tonic, atonic, clonic, myoclonic, and tonic-clonic. Characteristics or early warning signs, you have to look at characteristics of seizures when we talk about epilepsy. And these characteristics may vary from person to person, but each episode that the person has will look similar. And these characteristics can include confusion, blank stare, uncontrollable jerking in the arms and legs, and loss of consciousness, which is the most severe characteristic. Causes of epilepsy, they're often unknown. It can be genetics, and it may or may not run in families. More often than not, it just has to do with the genetics of the specific person. Brain injuries can also cause epilepsy. Infectious diseases such as meningitis and encephalitis, which both affect the brain, can cause epilepsy. And 3 out of 10 people with autism experience seizures, but there's no proof that autism and epilepsy are related. This is just a fact. To be diagnosed with epilepsy, you have to have at least 2 unprovoked seizures. A doctor may perform a neurological exam, and during that exam he may run a CT scan, EEG, PET scan, MRI, or some other kind of brain imaging to see what part of your brain is being affected. They also may run blood tests to look for infectious diseases, such as the 2 that we talked about earlier. Treatment for epilepsy, it is incurable, but children that experience epilepsy can outgrow it as they age. Anti-seizure medication will help reduce seizures, but you have to take them for as long as you're having seizures. So if you have seizures your whole life, you have to take this medication your whole life, because if you stop taking it while you're still experiencing seizures, it will make your seizures worse. Surgery is also beneficial. You can remove the part of the brain that is causing the seizures, but that is more extreme treatment. How does epilepsy impact students? It varies with each child. Each child will need different accommodations, and it will be affected differently. Absences is something that's common among all epilepsy students. They'll be absent because of doctor's appointments, because of side effects of seizures or medications, or maybe they experienced a seizure that morning and they couldn't function well, so they just stayed home. Absences are a big deal. People with epilepsy can suffer from thinking or learning deficits. They may find it difficult to learn or have memory issues. Developmental delay is also possible, but it's less likely than those thinking or learning deficits. Emotional and behavioral issues are common among epileptic people. There are psychiatric issues in 35% of people that suffer from epilepsy. Social isolation is also a big factor, especially you'll see it in PE classes. PE teachers will see epileptic students as fragile, and they won't want to let them participate in all of the more physical games or activities that other students participate in. So they'll set them to the side and not let them participate. But if physical activity is not a trigger for seizures, then those teachers need to let epileptic students participate to the same capacity that the other students participate. Because if you don't, then they could feel very isolated and become depressed or even suffer from anxiety. They'll feel very left out. They'll also experience side effects from their seizures and their medication. So like I said, a side effect from the seizures is brain damage, so that's what causes the thinking or learning deficits or the memory issues. Medication can cause aggression or frustration. among a lot of other things that teachers will have to look out for and understand. Epileptic students will be absent a lot, like I said, so they're going to need extra help from the teacher. Teachers will have to send makeup work. If they have those learning or developmental deficits, they may need more one-on-one time with the teacher to be able to understand it better. They may need additional resources that other kids don't need, or supplemental resources to help them learn better. And that's all.